Okay. Perfect. I'll go ahead and get us kicked off and started. I know we're a couple minutes behind. I blame it on my technical issues on my end this morning, but it wouldn't be a Monday if there weren't some hiccups. Good morning to everyone, and I hope you guys had a wonderful weekend. We are excited to kick off our week with our mayoral update, but you know I like to give you housekeeping. If this is your first time on our page, please make sure that you hit the like button and you hit the follow so you can get those timely notifications and updates. If you already like the page but you're not receiving the notifications, it's likely because you're not following us. So hit the follow button so you can get those alerts as we go live or post fresh new content. Of course, at the same time that we are airing this on our Facebook page, we have it streaming on our YouTube channel. That's Westminster Chamber of Commerce. And you can find a lot of the videos in the video section of this page, or you can go to our resource hub. That's westminsterchamber.biz COVID-19 updates for a wealth of information dating back into March when we really started kicking off these live broadcasts. Now, I see a lot of you that are on here with us, from Brian Head, Parker Brown, Brian Dice, Dave Carpenter, and several of you. So I'll start pulling up these comments as I see them and introduce this feature to you. So good morning to you, Parker. Thank you for tuning in and giving us a warm welcome to our mayor. Now, this is a feature that I encourage anyone that starts tuning into our broadcast to use. It is the comment section of our video broadcast. We like to engage with you along the way. And to do that, we need to give us that thumbs up or start commenting so we know who you are and some of the feedback that you might have. Good morning to our board chair, Brian Dice. Happy Monday to you as well. And of course, to Dave Carpenter, I see your message, and Brian Head. Good morning to you all. Thank you guys for tuning in to our broadcast. Maybe I need to start waiting a couple minutes, in the future to just kind of give you guys a second to remind you that it's 11 o'clock. Sometimes the earlier I get on, the more I have to wait before you guys start tuning in. But this video broadcast, as I mentioned to you, is highly interactive. We have our mayor who kicks off every week with us to provide updates on city scope, what they're doing as it relates to COVID, and our county updates, and then anything across the state that we should be mindful of and resources that are available to you at your fingertips, whether you're a business or an individual that lives, works, or decides to visit our community. Now we take up any questions or comments at the end of his spiel, so make sure that along the way, if you think of something, if something you picked up that you wanted to highlight, or maybe you had any questions that he may not have gone into, type that into the comment section of this broadcast, and we'll do our best to get that over to you and then answer either on the broadcast or at a later point in time. With that, I want to go ahead and mute myself, Mayor Atchison, and I'll have you take it away.
All right. Thank you, Julia. Good morning, everyone. I want to start back with a little bit of a business piece on it for this morning. Governor Polis last week announced that the state will be allocating $6 million to Energize Gap Fund. Now, this is the second round of applications, which opened this past week, and it will be supporting even more Colorado businesses. And the deadline to apply is not that far out, 2 weeks from today. The 26th is the deadline. Now, this fund will provide more than $31 million in loans and grants. They will be specifically targeted toward businesses and nonprofits that have been hit hardest by the statewide shutdown and that have limited access or no access altogether to other means of financing through federal, state, or local programs. And the GAP Fund is designed to meet this pressing need. It provides up to $15,000 in grant funds and up to $20,000 in low-interest loans to entities with fewer than 25 full-time employees. This represents a possible combined total of $35,000 in total relief. Now, in the first round, the state saw 6,000 applications submitted, requesting $79 million in grants and $56 million in loans. More than 50% of the applicants were from women-owned businesses. More than a quarter were rural entities. 12% were from Latino-owned enterprises, and 10% were from Black-owned enterprises. That's a pretty wide variety of people who are applying and from different backgrounds. So if you are in that need, if you have that issue that you still can't get federal or local funds, this GAP Fund, again, is open till the 26th. Make sure to take the opportunity if you need it. Now, the numbers I'm going to go into on the COVID, these are as of 30 minutes ago. So these are the most current numbers we have for Adams and Jefferson. In Adams and Jefferson counties continues to see growth in our infection numbers. And let me pause there for a minute. In our infection numbers, we look at two things: the number of infections per 100,000 and what the positivity rate is. Now, a lot of people have asked about morbidity rates and also hospitalization rates. To determine where you fit on the chart as a county, they do not use morbidity or hospitalization. And this is the way the state set it up. And we had people from both Adams and Jefferson County and our health departments that were in when this process was first established. So worrying about hospitalizations is important, but it is not a determining factor on where we stand as far as staying open or closing. It is only the first two numbers, the infection rate and the positivity rate. So today, Adams County infection numbers are 300.6 with a positivity rate of 7.2. The positivity rate that we need to be at is 5.0 or less. Jefferson County is now up to 140.1 with a positivity rate of 3.4. These numbers now put us in the safer at home category, but at the high end for Adams County and at the center point for Jefferson. Through an emergency meeting that was held last Wednesday night with the members of the Adams County Council of Governments, we discussed the recently received direction from CDBHE that Adams County is under a mandate to prepare and receive approval of a mitigation plan. The plan is currently being developed and must be submitted to CDBHE this week. After receiving approval of the plan, we have 2 weeks to institute the plan and show progress in the reduction. If we cannot show progress on a reduction in infection, then the state will place us firmly in level 3 of safer at home, which again mandates a further reduction of businesses being open, facility closures, the size of public gatherings, and many other items that have great impacts on the cities and our business community's operation. It is important that we stay informed, do everything you can to aid in getting these numbers reduced before we are moved by mandate into more stringent measures. Remember, this affects us all and will take us all to solve. And when we talk about the safer at home, there are 3 levels. Level 1 is where you'd like to be. That's an infection rate of 0 to 75. Safer at home level 2 is an infection rate of 75 to 175. And the high risk level of safer at home, level 3, is 175 to 350. We are at over 300 in Adams, and Jefferson County again is at 140. So even though Jefferson County is in level 2, their numbers are growing. Not quite at the same rate that Adams County is, because Adams County's numbers are jumping quite a bit on a daily basis. We have to maintain certain things, but if we are forced to go into level 3, then the levels that we are seeing for our restaurants going from 50% of capacity or 50 people will drop to 25% and 25 people. Now, in the 3 primary categories of what we are seeing, and some of this is information that's not accurate in some of the conversations. So I want to make sure we talk about that. The numbers that we're seeing from schools, as an example, and this is confirmed by both the Jefferson County and Tri-County Health, we are not seeing infections that are being caused at school, and most of those kids who have been checked or tested have been shown to be having gotten the infection at home or somewhere other than school and then come to school with it. So it's not being generated at school. So that was a misperception that's being touted out there. And I just want to correct what we have been told by both health departments. What we are seeing our biggest numbers is private gatherings, the family groups and groups of more than 10. By both the health departments and the state, a group of 10 or more is considered a large group. Anything less than 10 is considered small groups. But whether you have a large group or a small group, that's where most of our infections are coming from. Now, I am not going to, and neither is anyone else going to come to your home unless there's a large party there that somebody's complaining about, and it's probably going to be something other than just whether or not you're wearing masks. But it's us as individuals, our homeowners, our private enterprises, these are the ones who are driving our infection rates to jump in the numbers that they are. If we don't get them down, folks, it's going to be back to the point where, because we're at 300 in Adams County already, I would expect that within the next few days, we could hit the 350 mark. That means we're moving into the stay-at-home order. We have 2 weeks from the time this plan gets approved to show significant improvement and getting their numbers go backwards. But also at the same time, we're starting to move into the flu season. So our infection rates are going up. But getting them confirmed as to whether or not they're COVID numbers or flu numbers is a challenge for all of our medical expertise. We still have the testing site at Mayoral for a short period of time left. The two big ones being the Pepsi Center and Aurora, those have closed. We still have the uninsured and the homeless center at the MAC on Thursdays. Use these opportunities. If you've been around someone that's been infected, and we know public officials here locally have been affected as well. And right now, with so many things going on, especially in the political world that we have today with a national election coming up here in a couple of weeks, there's a lot of people gathering. Social distancing, wearing your mask, washing your hands, being observant to stay social distance as much as possible. And I know it's a challenge, but we still are seeing a good number of people try the best they can. I did not get a new number on mask compliance. Last I heard, it's still in the low 80%. That's not bad, but it could be better. So those are some of the things that we are most concerned. Every day, usually a couple times a day, I'm checking the numbers to see what our infection rates are. I can't afford to have one business in this city have to shut down or reduce their percentages. If anything, we need to get to the point where we can get those numbers to a higher level of people can come to restaurants, they can go to shop, they can go wherever they want. It's up to us. We are the ones controlling the issue. If you have a business, I know you're getting sick and tired of me saying this, but you control our destiny. If you don't enforce the rules, people are going to get infected. Our numbers are going to go up. We are hoping to start back to City Hall later this month, but with these numbers on the continuous rise, we will have to evaluate that decision on a daily basis. City Hall is important to everyone. We understand that, but we also have to understand what the infection rate is to not only you as the general public, but what happens to our employees. And we have employees just like you that have comprised issues that affect their ability to be out in the public. And their compromised health conditions is not something we want to be showing them that there's an infection because we've opened up City Hall too early, or any of our other facilities. Now, we're still on track based on where we were last week to open up some additional facilities that could be undone depending upon the mitigation plan that gets approved by the state. I'm hoping before we meet next week to have a good idea of where we're at. The county is preparing this. It's supposed to be reviewed by the cities before it goes to the state. So that means we should be getting it in the next day or two just to see what's being proposed. But Westminster, I think, as a whole, has been very proactive in trying to get these numbers down. In my observation of being out in the city where I have been watching people come and go, the restaurants or the businesses I've been at, my observation on a personal basis is that our mask usage is pretty high. Are there still people coming in and going out of businesses without a mask on? Yes, there are. So it's up to us. Nobody can sustain another long-term shutdown from any business level. So Juliet, for you and every member of the chamber, every person who uses a business in the chamber, this is up to us. Now, one last mention on an item for the city. Again, we started our first series of briefings on water rates this past week. We do not have one this week. The next one is going to be Tuesday of next week, so we continue to do that. But what we did find out of our first meeting, there was such a large amount of information that's being gathered that the planned 2 hours was too short for the amount of information. So we're looking at extending those possibly, but at least extending the number of meetings because there's just too much data being added. So we will probably add a scheduled fifth meeting, and that date has not been determined yet. But the other four are still, let's see, October the 20th is the next one, November 5th, and November 17th. Again, the current is scheduled from 6 to 8 p.m., but we will probably be adding a fifth one in there over the next week or so. Well, the downer as this morning is our numbers are not looking any better. So Juliet, if you want to open it up and we'll see if we have any questions and Sarah, see where we go from there.
Absolutely. And I see Rick on here with us. I also see Counselor Seymour and Melissa Snyder. Punit, thank you guys for hopping on here. We have with us our mayor sharing some updates as it relates to COVID numbers from both counties, and also some information about what's on the agenda as it relates to water rate sessions that they're holding to provide information, and some drastic changes that may or may not impact our businesses depending on compliance. So there is a sliver of positivity in some of your message. You know, I look for that in every week whenever we do have some negative news like this, but it's nice to hear that where it's coming from, where the increase is coming from is from those private home get-togethers that people are having. That helps, one, because it shows that our businesses are trying to do their part by holding on to compliance and mandates that are in place. But the second is that it reinforces that if you are going to a personal type of gathering that's larger, you know, still keep in mind those practices that we have in place, because if this is where this is spreading, then we need to make sure that you're still doing your part if you are getting together with other people, that you're not putting yourself in a position that is compromising them or yourself. And then to the mayor's point, you know, there are testing sites that we have. We've got one for our uninsured that's down at the MAC here in South Historic Westminster, and of course we've got the new one that's up at Waterworld. I personally have gone out. I know, Mayor, you shared some of our public officials have also contracted COVID in some way. I went out as soon as I heard and went and got tested. It literally took me 5 minutes to register on my phone on my way over there, and then it took another 5 minutes through the line to get my test. And within 3 days, I had my test results. So it's not difficult to do. Just go and get tested. It helps you have that peace of mind. It also helps us with understanding where is this spreading from, so we can continue to combat those issues that we're hearing, right? So the mayor did talk about how this is not coming from schools, which a lot of people had concerns about. We're opening back up schools. How is this going to fuel that? And what we're seeing is that that's not the case. So thank you, Mayor, for going in detail on some of those. Like I said, there was some positive news that is there, and I think that's mentioning absolutely. Councillor DeMott had a question for us. This question came as it relates to hospital beds and mortality rates. I know, Mayor, you shared that there were two primary things that we look at, two primary indicators as it relates to the COVID numbers. Do we know in specific about the hospitals or mortality rates? I know that these were not ones that we initially try and reference, since they're not connected to our different phases and levels of reopening our businesses.
Based on the state report, what I saw in the state is that hospital bed capacity is still going up, but it is not anywhere near where it was earlier this year. But again, hospital beds and mortality rates are not part of this process, and that's been explained. I try to do that periodically. Those two numbers do not have an effect on what your numbers are. It's only the infection rate and the positivity rate. That's the only two things that determine what safer level you are at.
Yes, thank you so much. I mean, and I do see that. I see the important. I see the value in this question, Councillor DeMott, for you to ask. For absolutely, it makes a difference. The types of cases that we're experiencing, then it also makes great to understand what our states and what our mandates are going after, and that they're looking at some of the other factors that are there as well. It looks like Dave Carpenter shared, so hospitalizations are not included, healthcare system was rationale. Okay, so earlier on, there was some rationale behind the shutting down was the overwhelming overwhelming the healthcare system. I think this was very earlier on, Mayor Atchison, whenever we were sharing, mass usage, so that we're not overwhelming the system that's there. And so this is mainly a comment to that, for the systems are not being overwhelmed in our hospitals, then there may be some contradiction with that initial one that they had shared out.
So let me try to respond to Dave Carpenter's comment. The content is still that we don't want to overwhelm the hospitalization numbers, so that there are a certain number of hospital beds available for our COVID patients. Now, we still have people who have COVID that are in the hospital, but we're not seeing the severity of the infections that are driving the people into the hospital. It doesn't mean that we don't have infections and we aren't still spreading the virus. It's just that those that are catching it appear on the surface to have better immune systems that are helping it not be quite as bad, that it's going into hospitals in great numbers. That does not mean that we don't have people still going to the hospital. But right now, the numbers that are being seen at the state level that are being reported, and that was as of Thursday of last week, is that we are still in the, I want to say 300 category, and they have some 1,800 beds statewide available. So as long as we can get that low, that hospitalization number may be low, but that doesn't mean that we don't have a lot of people infected. It just means that the severity of the case is not at this point requiring hospitalizations.
Thank you for that, Mayor. And, Dave has some pretty good questions, Dave Carpenter. It looks like his secondary one is as it relates to the county. We do often reference our counties whenever we're sharing these numbers and figures that we have, since both of those health departments are the ones providing us with numbers, whether it's our infection rates or the number of cases that we have, et cetera. So his question pertains to, on the Adams County side, of course, being Westminster, we're situated proportionately on the ADCO side, and we reference numbers that we're getting from Tri-County, which also encompasses other municipalities. That being said, his question is a little bit more, trying to localize it here into Westminster. Do you have any sense of what those numbers are here in Westminster as opposed to the entire county, since obviously ADCO is a huge county and there's other areas that are outside of our direct control?
The best I can answer to you, Dave, is that we believe, based on what Tri-County is reporting, that Westminster is included in all the counties. There is no city in Adams County that is immune from this. Every city's got it. Can I tell you exactly where in the Adams portion of Westminster is at? No, I don't have that level of detail. I can just tell you that we're all sharing in it.
Thank you. And his next question, I'm sorry, he's on fire today, but these are good questions. I feel like they're fueling some good discussionary points. And this was something when I alluded to and I referenced that we should go out and test, especially if you've interfaced or have been interacted with somebody who has tested positively, to go out and test. I know you all have seen Councilor Seymour constantly type in, we need data, go out there and get tested. So his question comes to, again, related to hospitalization and morbidity that aren't being used, just the cases that this may create that perverse incentive to not test, because some people are seeing that those rates are going down. If no one tests, then we don't know the true rate, and the official opening rates go down. So it's more of, I feel like this is more of a comment than a question, unless, Mayor, you see something in here that you wanted to address.
I'll try to answer Dave's question. Is hospitalizations are still tracked. Morbidity is still tracked, but it's not the determining factors of which level of safer at home we go into. But they still watch that, because we still need to know if there's a surge coming of hospitalizations that are going to potentially use up the capacity of the beds. Can you beat the system? I've never known anybody who couldn't find some way to beat a system if they worked at it hard enough, whether it's gambling or something else. But the problem that we have seen, as has been discussed with our health department, is there are some people who are afraid to be tested, because if they get found to be positive, they can't go to work, and they don't have a way to service an income if they're not working. Unfortunately, we know that's happening. What can we do to help is to try to encourage them to do the same thing we do with your businesses. If you have employees that are positive, and we've given you opportunities to help you with those payroll problems and the rent payments and mortgage payments, you need to take advantage of as many of these programs as you can, as well as the employees. I would a lot rather see somebody taking unemployment than coming to work sick, knowing that they're sick, and then spreading it to other people. That's just going to compound the problem. And I understand that people are sometimes leery about taking the test. I've been pretty fortunate. I haven't had any symptoms. I haven't had anything that indicates it, but my test still says I'm negative. So that's okay. But not everybody is going to be as fortunate as Juliet. Now, I know when she said she was on the phone on the way over to the test, she was not driving. She was stationary. But I think it still behooves us to find out how big it is, because even though with all the people who have taken the test, we still don't know how much that is, because some people are leery about taking it because it may affect their employment basis. I'm afraid that's a problem that we don't have an answer to. It's an individual choice. No one's going to force you to take the test, but they certainly might force your business to be shut down.
Yeah, and you know, and to combat that, if you are fearful of taking your test and having the result come back as it is, and you staying home, then you're really not doing a good thing in the long run. Because if your business ends up closing, then you won't have work to go and seek the dollars that you're looking for. So it's a cyclical thing, and you do have to definitely go and get tested. And I know people are fearful. There have been some stories about the swab going all the way up into the nose. They no longer do that, from my understanding. At least mine was not that. It barely went in halfway. I mean, they still go up there, but you're not poking out your brain. So if you're fearful that you are going to experience any sort of pain, I can tell you it's a little bit discomforting, but there's no pain that's involved in it. And yes, of course, I was paused and typed into that. But that I referenced that because of how simple the application was for you to fill out. It doesn't ask for extensive information. It's your name, your date of birth, and your address. So you can be able to go out and get tested. You have that reference number. You don't even need to pre-register. You can go in line and do that as well. So those options are available to you. I see Counselor Seymour has gone online and kind of pulled a number as it relates to the mask wearing rate. Said correction, 97.56 mask utilization observed in Westminster by Tri-County Adams County government. So, and that's something, yes, the mayor also mentioned earlier on in his observation of seeing people going in and out of some of those businesses. He's seeing a strong percentage use that. So I think that definitely reinforces that percentage that you're finding, Councillor Seymour. And of course, I do thank you for the for the nice vote of positivity that's over here. We are going to have a great Westminster week. We're all going to do our part in making sure that if you are interacting with somebody who's contracted to go and get tested, and as businesses, it seems like we're doing a great job on everything, especially as we're tracking where the rises are going from. It's not coming back to necessarily our business community, which is nice to see, and utilize some of the funds. So the mayor did talk about the Energize Colorado, the GAP fund that has reopened for a second opportunity for businesses that have been severely impacted by COVID to either select grants and or loans that are out there. There's also the city's winterization grant as our businesses are transitioning into the winter months to consider and apply through on the economic development page. We also still have our mini grants with the Adams County, which we've added another component as it relates to winterization and some things that you might need to keep in mind. And then of course there's the last thing I wanted to reemphasize is PPE. For those of you that are businesses in or around Westminster, there is still free PPE that you can access. Just submit the application. You can find that in the news section on our page, and we're partnering with Jeffco to make sure that we can get that out there to you guys in a timely manner. So a lot of great resources. I re-mentioned a lot of them so you guys can get an idea and remind yourselves, but remind other people that if they're needing funding to be able to institute some sort of or some compliance measures that are in place, if they have no access to some of the PPE or information, that's all there. And then if you're a resident that's looking to get tested, these are free and resources that are out there for you. Mayor, you touched a little bit about, and I'm going to curve it now outside of our COVID, because I'm optimistic that people that are tuned in and those that continue to watch this and spread this message will pick up how important it is that we keep our businesses open, and that, if it's wearing a mask so we can get them all back open and moved into the next phase, that we need to do that, because I mean, they're not doing that great, and still being open where they are right now, it's nice for them, but we definitely don't want that regression either. So we're transitioning from COVID into this water rate session that you shared with us. This was an opportunity for our residents and really anyone that had an interest in understanding the water rates, the implication that's associated with an increase might look like, et cetera. We've had one of those sessions. There are a couple more, and I've typed in the dates of that into the comment section of this broadcast. Now, these are all virtual, or are these in person as well?
The last part, Juliet, go ahead and say it again.
Did you hear me out? Great, now they won't take it. The water rate increase session.
That's all virtual. It's a study session. Everyone's encouraged to listen in, but it's primarily a discussion between staff, our facilitator, and the city council members.
Excellent. So it does take place during the study session time.
And these are set aside specifically for just that one item on these study session nights, on the nights that I gave you.
Excellent. And I typed into the comment section, I believe we have the 20th, the 5th of November, the 17th of November, 6 to 8. There is a possibility that the time for discussion, or the time for this presentation, really extends, because it seems like there's a lot of facts and information that are being shared. But if you're at all interested in the water discussion, these would be beneficial for you to get an idea on what's going on, why this is being discussed, and be able to ask those questions. I also see Michelle Trujilla, that she's hopped on here. I see Ala as well, and I see Alan. Thank you guys for tuning into our broadcast. I'm going to pull up Dave's post. I'm going to skim it real fast because I can't see the mayor's face at this point. Thank you for the big text, Dave. Thanks for the reply. I get that there could be fear testing financial. It seems we're using wrong data for shutdowns. I get the state doing the best part. Okay, direction state and local health. So Dave Carpenter is referencing that, he understands that the types of data that our state is using when considering our mandates and guidelines that are being set forth, but that they're factoring other data points seems like that could be beneficial as well. So, I don't know how this is something that's been set since the start of COVID, really. So it's not something that's new. It's just really continued on. But it is hard sometimes because you hear different rhetoric that's out there. And so that might lead to that as well. So I just wanted to pull up his comment. We also have Peter Brissett. Businesses are doing what they've been asked to. If we go and restrict them because of the numbers, it's a punishment. Business coming from private things. Right. Yes. So this is a nice comment, and I'll pull it off so you have a chance to comment back on this, Mayor, but it does come from Peter Brissett. He's referencing exactly what we were sharing earlier, that these numbers that are increasing are coming outside of our businesses. But unfortunately, who gets hurt in the long run is our business community, because they would have those restrictions that they're following.
You're absolutely correct. The point is the general public has got to get on board with this. We can't always say, well, it's the business's fault, and that's what I'm trying to point out. Unfortunately, we have a mandate for the county, and it's not picked up on you as an individual or me as a business or however it's set up. When people don't comply, the rules apply to everyone, regardless of whether or not your particular piece is contributing to this or not. But it's up to us to continue to push as much as we can wherever we can. Nobody wants to harm the business. No one wants to harm our families or other stuff, but this is not something that we brought upon ourselves. This is something that brought to us. It's coming from a foreign country into us. The problem is we're having to deal with it. We have over 230,000 people who have already lost their lives. We cannot recover those. I don't want to see one person in this city or this state or this country die from this simply because people are not paying enough attention. I applaud the businesses that are doing everything they can. Like I said, the ones that I've been into, I see very positive work coming from those. But I can't control what goes on in someone's private home. And the more we re-emphasize that with our customers, we emphasize that through whatever means you have as a business owner, hopefully they'll get the message.
Yeah, and I think that's the really the premise of your statement, Mayor, is that we're emphasizing in all avenues that we're in. So if you are going to a private gathering or if you are connecting with people, then still reinforcing that to others so that they're taking care of that and we're not trying to hurt our businesses in the long run. So Ryan Thompson and Wayne Anderson, I know you guys are hopping on. This broadcast has had some pretty great engagement on here already, but we are over a 30-minute mark. Believe it or not, this has gone by incredibly fast. So I want to thank you guys for tuning into this broadcast, for commenting and engaging with us, and thank the mayor for being on here with me on a weekly basis and sharing whether it's great news or not so great news as we had this week. It's still news that we should be all mindful of. And I appreciate him for finding that 30 minutes on a weekly basis to be here with us. For those of you that did tune in, please make sure that you share this message out. We want this to get out as much as possible to everyone so that they can know about what's going on in our community and can spread that word as well so that we're ultimately trying to change the direction of where things are heading right now and that we're not hurting our businesses in the long run. I, of course, want to also share that if you have hopped on toward the end of this broadcast, you can always rewind and rewatch it. Give us the hashtag replay so we know that you in. I'll be back here tomorrow at 11 a.m. talking commercial real estate and what that market has looked like as a result of COVID with a business success story from one of our partners. So please tune in around 11 a.m. tomorrow. But thank you so much, Mayor, for being on here with me. I hope you enjoy the fantastic day.